We always open Tuesday morning forum with a prayer from our chaplain, who is not here today. So we will ask Ms. Laura McCletty if she will lead us in the word.
Holy One, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Help us to engage in meaningful discussions and allow us to come close together. In these blessings we ask in your name. Amen.
Amen. Amen. All right, we have Mr. Jules and Ms. Fuentes from C.W. Williams today as our guests. We will allow them to introduce themselves shortly. Following our presentation, we will take questions from the audience. Questions should be questions. Raise your hand and we will add your name to a list, and I will call on you as your name was added to said list. Questions should be 30 seconds, and the answer you receive is the answer you will accept. We do not debate. Again, our timekeeper, Ms. Natalie McElrath, will signal you when it's time. Without further ado, we will allow the lovely people from C.W. Williams to get into their presentation.
Good morning.
Go back to mic check.
Slide that to the green light.
Mic check.
Good morning, everyone.
Morning.
My name is Jennifer Fuentes. I'm the executive assistant to the CEO, Ms. Debra Weeks, at the C.W. Williams Community Health Center. Thank you for having us. Unfortunately, Ms. Weeks woke up ill this morning. She has a fever, so this is why she's not here. She sincerely apologizes, and she would like to come back and be here herself if we can get that arranged. So just wanted to put that out there. So a little bit about what I do for the C.W. Williams Community Health Center. Not only am I Ms. Weeks' executive assistant, I help in many ways. So especially with the new building, which we will show in the slideshow and we will discuss about. I not only assist with scheduling meetings for her, keeping her calendar updated, I do a lot of behind the scenes with, all the employees at C.W. Williams. So it is a very big role in the shoes to fill. It's a lot of work, but I do enjoy it. A little bit about me, I did work for special education for 13 years in New York City Public Schools before I moved down here to North Carolina. And then I started working with the C.W. Williams Community Health Center. What I do love about what we do is helping the community, helping those in need. And even though it's two different career paths, C.W. Williams being medical and special education, the one thing that I saw that was very similar was helping those in need. So that's why it tugged at my heartstrings, honestly, and working with C.W. Williams, seeing what our team does for the community and our patients is what I truly enjoy seeing. Okay, are we ready for this? We are okay.
What's powerful? What can we do? No, I don't know.
Let's go. Keep going.
Okay, can he go? He can speak about himself too.
Yes.
Oh, we want to hear about you.
Oh, yes. Good morning, everyone. Good morning. I'm Julius Royals, and I've attended Tuesday morning meetings for several years, and I was absent for quite some time, due to travels with another organizations that I partner with. But I'm back with C.W. Williams, handling all these special events, and I'm so honored to be back with the Tuesday morning meeting, and also in the memory of the Sarah Stevensons, that was a mother, and I know she's watching over us this morning. And I'm with C.W. Williams. I've been with C.W. Williams for many years, doing outreach. I've attended several of these meetings, and looking forward to you guys coming out to visit our new C.W. Williams that we just recently opened over at 3333 Wilson Boulevard. Please come by. We'd be happy to give you a tour of our new facility, and we're also located in Pineville. Thank you. If you have any questions, we do Q&A afterwards.
We still are open at 5800 Old Pine Road, as he said. What's the beauty in that is when 3333 was shut down for, rebuild, reconstruction, we realized that on that side of the tracks, when we say train tracks, so that big train rail track right there on Douglaston, we noticed the population that was needed there was population we really just tapped into a little bit. We noticed that the Spanish community was much higher on that side. So that brought us awareness in other ways of how we can help with the community here on near Old Pineville Road. So that opened doors of us collaborating with other organizations and just seeing how we can help over there. And that's why we're still open at 5800, because we still are needed on that side, and we are growing. 3333 Boulevard. So I've been with C.W. Williams for 2 years. I was not there when it was originally opened. I did see the building one time before it was torn down. And to see what it was before and what it is now, and then seeing the community stop by, people coming in, and especially while we were still under construction, people would just walk by, and they were like, "Oh, I used to come here, and wow, what a difference! It's so huge. I never thought, it could, this would be what, the building could be anything like this." That was very comforting to hear from different people, and there was also a lot of homeless people. They're saying that they also were seen by Dr. Williams himself. So it was a nice history lesson, and getting those people stopping by and talking to us, and they're still coming our way. And so it is a beautiful thing to see what it was and what it's become and what it's still, gonna be in the future. It's not gonna work. Okay, so.
Everyone has those reading, and I'll say
Yes, so if you did not receive a packet, please let me know. Everybody has it? Okay, perfect. Oh, beautiful, thank you. So in the packet, what you will find is a letter from Ms. Weeks. You would also find a fact sheet behind it, our brochures with our services, and so on and so forth. So just a little history about C.W. Williams. Dr. Charles Warren, which is C.W. Williams, he was the...
Try it now.
Oh, try it now. Okay. So sorry.
It's all right. That's all right.
I can't do full screen. Oh, okay. I will mess with it. Okay. So, thank you so much for your patience and grace. I truly appreciate it.
You're all right. You're all right.
Okay. So, Dr. Charles C.W. Williams, Charles Warren C.W. Williams, was the first African American that allowed to board at both major hospitals in response to inequity found in the provisions of healthcare. He began a crusade to provide quality healthcare for those underserved. Now, what's very beautiful about this dream and ideas that he has, it challenges us as an organization to continue to think bigger and deeper on how we can make a difference now that he's gone in his name. C.W. Williams Community Health Center was established in 1980. Our mission statement is to improve spiritual, physical, and so sorry, I'm so nervous right now.
You're all right. You're all right.
Our mission statement is to improve spiritual, physical, and psychosocial health by providing access to highest quality, comprehensive health care and ancillary services, regardless of any individual's ability to pay. So what this means is, especially the last part, is we are not a free clinic. We are a community health center. So we will get into that as well moving forward. Who we serve, our patient data. So the communities served here, the counties is Mecklenburg County, Anson, Cabarrus, Gaston, and Union. Those are our main counties that we do serve, but we do serve others. Anyone who would like to come and become a patient of C.W. Williams, no matter where they live, they are welcomed. So over 12,000 patients served over the past year. We have over 30 patients encountered last year. Comprehensive and quality services, 68% of Black and African American, 22% of Hispanics, 8% white. We are also seeing an influx in other racial communities. We've had an increase in our Russian community, Ukraine, and also our Asian population. Our locations and services. Our mainstay. As you can see, 3333 Wilkinson Boulevard, this is what it looks like now, and this is what we came from. It has changed. Even though we were 3 floors before, it was much smaller. Now we're actually in the middle of the property, and we have 2 floors with multiple services. The idea what Dr. Williams always wanted was a one-stop shop. So pretty much to have as many services that we can provide to the community under one roof, especially due to people's circumstances. You know, we all work. Taking time off is difficult. Our children go to school. Getting them out of school for multiple appointments is always hectic with everybody's personal circumstances. So having multiple services under one roof is so helpful for our patients, because if they do take the day off of work, they can make an appointment with our dental services and then with their regular provider, and so on and so forth. As I stated before, we're still at 5800 Old Pineville Road, and we're also at 800 Clanton Road, Suite J and M. We also do have mobile units. We have a medical mobile unit and a dental unit. In the works right now, we are having a maternal unit, mobile unit, for our mothers who are expecting. And we are also working on a behavior and health mobile unit. So these are other services that we're literally taking on the road. Once again, our new facility at 3333 Wilkinson Boulevard. We have a very lovely area, waiting area. It's very, as you can see, a lot of windows, a lot of light, bright, welcoming. The first floor, as soon as you come in, it's just, I'm in awe of what it looks like. It's always gorgeous to walk in the morning and just, you know, when I'm opening up, it's beautiful knowing that our patients can come to a health center at, you know, that looks like this, that feels welcoming and warm and inviting. We do have on the first floor our medical hub. What we love about this, sincerely what I love about this area is the medical hub, there's no separation between our providers, our nurses, our MAs, or even our students. Everybody sits in the hub together and they work together, so there's no separation. This brings a feeling of, you know, teamwork and just everybody able to speak with one another. There's no, in the sense of not able to reach our doctors, like our students, our MAs, they're always able to communicate because our doctors and providers are right there with them in the hub. So if anything needs to be discussed, they are able to have each other, access to each other quite freely. Our exam rooms are, each exam rooms has a patient portal. Some of you may have that at your own doctor's offices. What I love about the patient portal, you can see it in this picture right here. Our patients play with it. Sometimes we go to the doctors and we don't really, like we have the symptoms that we're going to, but we don't really think of other symptoms we may be having. And we don't think they're in connection to what we're dealing with at the time. So once they start playing with the patient portal, it makes them think. because it has the anatomy of the body, it has other things that, they can educate themselves on. So they start thinking like, well, I'm here for, I'm not like headaches, constant headaches, but since it has the anatomy of the body, it gives information such as like with the jaw, the teeth, or, heart issues. And they start asking questions like, well, I've been suffering from this. Could it be in connection with this? So it actually gives our patients ideas of what to ask the doctor. Sometimes we don't think of things because we're so focused on one symptom we're having that in reality, other symptoms can be affecting why we're feeling this and like that particular symptom in general. So that's what I love about the patient portal. It also allows them to get information in their own language. And it's a teaching tool with our doctors for them to show the patients what exactly is going on in their body, because it does pull up the anatomy of the human body. So they're able to touch different parts of the body and go deeper into depth of explanation of what they're feeling inside and having a visual. So that also helps. One of my favorite wings in our new facility is our maternal health and pediatric wings. To see the amount of women who are now coming and getting health care, prenatal and post, is amazing. So this wing is very special because we do have an Embrace program. In your packets, that service is highlighted. Our Embrace program, I'm so sorry. So our Embrace program, what Embrace stands for and what many people don't know, it's empowering minority mothers to believe and receive access to care equity. So this, thank you, Royals. So what they provide is OBGYN care, pediatrics, postpartum care, pathology and lab, counseling, pharmacy, nutritional service, education, peer support groups, transportation, referral services, and early sex detection. So what is beautiful about our maternal program is we now have hubs on different parts of Charlotte. And in these hubs, the mothers are able to go and get checked out, get supplements for their children, Pediasure, things like that. Also something they've been doing, which is very special. Some mothers don't have support, they're alone, they're pregnant, they're worried, they're scared. What our director and our group has been doing is small little baby showers for them, just to get them started with some things that they need, and and the mothers are appreciating that. So that's a beautiful thing that they're able to do. And so not only is the maternal healthcare, it's a pediatrics one too. So our PEDS program allows our mothers who are expecting and have little ones to also get checked out, So our examinings there are, some of them have little characteristics, zebra themes and stuff to make it more welcoming. We have comfortable little small couches so the mothers can sit and nurse while they're seeing the doctor. So we've made it, the vision for this wing was so that mothers can feel comfortable. Sometimes they have their diaper bag, their stroller, they have a toddler, baby in there, and it gets kind of hectic. So what we wanted them when they came to the doctor's office, they have a place where they can slightly relax. Because as a mom, if anybody's mom, you normally can't slightly relax with all of that going on. But what we wanted was at least them to have a moment to just enjoy the doctor's office visit as best as they could. Okay. On the second floor as well, across our maternal wing, we have our dental. It's beautiful. So if you come for a tour, it is actually very gorgeous. There's a lot of windows. Everybody says they have the best room in the house. Our dental suite was on Weber Avenue before, so now it's in-house, which makes things a lot easier for our patients to get to, as I said before. So we have right now three dentists, and I want to say, I'm so sorry, and 3 dental hygienists, yes, and they're bilingual speaking, the majority of them, so that's also a plus for us. Down the hall from dental, we have our behavior and health wing, where we help those in needs with emotional, mental needs, whatever they need, and also for our patients who, are going through substance abuse. They get counseling, they get assistance in that manner. Our behavioral and health wing, also, what they do is we have psychiatric care, we do evaluations, medication management, substance abuse counseling, care case management, medication assisted treatment, which is also known as MAT, and peer support group and support services. So I believe it's once a month or bi-weekly, they meet and they have their support groups. They do also individual counseling for couples, not only for couples, individuals, and for minors. So those have been, especially nowadays, as we see, children have major access to the internet, and our youth is going through a lot with the pressures of the internet and what it tells them they need to live up to or be. So that distorts a lot of their personal growth and how they should grow as individuals. And as we can see, nowadays, the suicide rate for young children is extremely, extremely high. So the fact that we can help our kids with any mental health needs is something that is incredible. And, to see not just CW Williams Community Health Center be a part of that, but all doctors and, any people who are in the mental health world to assist with that, because it's unfortunate how much access they have to the internet and how much pressure from their peers and just, people they look up to puts on them. So this is just an amazing service that we can provide for our community. So something else that we have in CW Williams at 3333 Wilkinson Boulevard building is our nutrition center. We are working on getting a nutritionist and a dietitian. So with that, our nutrition center, we have a kitchen where once we have our nutrition dietitian, we're gonna have a program that's gonna allow our patients to come in at night for basically like a cooking health class. What they're gonna do is they are going to teach our patients what are healthy foods, what are not, and how it can, like simple ways that in their everyday life, they can make adjustments to their diets to help them continue on their health journey of getting better and just to maintain a healthy lifestyle. So that's exciting because as we know, junk food is the cheapest thing out there, but unfortunately the things that do nourish us and keep us going is the most expensive. So with this program, we hope to allow our patients to learn ways and they can make changes to their everyday lifestyle with their circumstances and just make better choices to continue to be healthy. Now, medical service list is general primary medical care, diagnostics, laboratory. So we do have an in-house lab where we take blood and other, specimens and things like that, to get examined. Coverage for emergencies. During and after hours, we do have after hours, especially when it is a federal holiday and we are closed, we still have our after hours and doctors on call for our patients. And we let them know that in case of emergency that is not required for 911, they can call us and our doctors can assist them after hours. Traditional Chinese medicine, we have Dr. Compton. She is amazing. We do, she does acupuncture, cupping, seating. She does holistic medicine. She also works well with our behavior and health department. For those who are coming off substance abuse, they normally experience painful withdrawals. So our Chinese medicine helps them with that. You know, it helps subside these side effects of coming off whatever they're withdrawing from. So that is something that our patients have benefited from. We have voluntary family planning, immunizations, well child services, gynecological care, prenatal and postpartum care, and HIV/AIDS PrEP and PEP services. So yes, on both locations, we do have our HIV and AIDS and our PrEP and PEP services. So they're in both our buildings. We also have in both our buildings our behavior and health department. Both our buildings, we do have labs and our pharmacies. Ancillary services list. So we have insurance, eligibility, and assistance. We have our sliding scale services for those who are uninsured and underinsured. We have our case management, health education, our food pantry, and I'm excited to say we are working on a clothing pantry. So that's exciting. We have our outreach programs and team, translation and transportation. Transportation is something major, especially with our patients. A lot of our patients use public transportation. Now with the colder weather, no one wants to wait for a bus, so they're able to use our transportation department. They make arrangements to be picked up from their home and taken to their appointment, and then picked up from their appointment and taken back home. If we refer them out to any specialists, we also take them to those appointments as well. So that's something we do provide. Our food pantry, it's a lovely thing to see. We have a lot of our patients who are in need, and they come in and they ask for things that they need, and we're able to help them. Monthly, we try to do something to help different people and different needs. So we also go around and assist with our homeless patients. We make sure we give them things like toothpaste, brushes, deodorant, socks, just those things that, we sometimes take for granted that we have easy access but are just so necessary in day-to-day life, and they don't have. Our translation services, we have Answer Life that we use, and what we can do with that is pretty much assist anyone with any language that they need. Sometimes there is a wait for certain languages, so what do? We go straight to our phones and use Google Translate to the best that we can, and we tell them hold tight until we get somebody. Especially with our Ukrainian and Russian population coming up, getting bigger, it's been a joy to see their reaction, like, oh, they're really trying to help us. And then once we get somebody on the line, we're able to have them translate fully for, our doctors, our MAs, and so on, or even our front desk personnel. So additional services, as we spoke about, is dental, preventative dental, restorative dental, emergent service, pediatric services, and adult services. So what a lot of people don't realize, if you don't take care of your teeth, it can actually cause heart issues. Unfortunately, a lot of people also don't realize that if you have an infected tooth, it can cause major issues and even an infection in your brain. So it's extremely, extremely important for our patients to have dental services. So we are glad to offer that. A little bit more about behavioral, as we spoke about, we have psychotherapy counseling, group counseling, substance use disorder treatment, substance use disorder counseling, medication-assisted treatment, MAT, which we spoke about, and case management. Our maternal, we also spoke about again, is OBGYN and healthcare, educational courses, workshops, community baby showers, mobile maternal care, ultrasound, community kiosk, and resources for supplies. We also are working on getting a medulla, so that is exciting. Traditional Chinese medicine, as I spoke before, we have acupuncture, acupressure, cupping, seating, nutrition management, herbal treatment, and therapeutic massage. Our in-house pharmacy is 100% our 340B pharmacy. We have medication therapy management and chronic care management. So when our patients come in, they need assistance with understanding their medication, how it should be used, and so on. They can meet with our pharmacists and have a consultation with them, and they will discuss it further in detail. Our HIV and AIDS program, we have HIV treatment, HIV prevention, which is PrEP. A lot of people have seen the commercials now for those on TV. They're coming more and more out. One misconception for PrEP is that it's only for people from the LGBT, oh my goodness, I'm so sorry. LGBT, I did say it right? Okay, community. No, actually HIV, the HIV prevention, which is PrEP, is for anyone who's sexually active. So that is something that we're also, educating our patients on. We have STI treatment, we have Orion White services, an emergency financial assistance program, and peer support. Oh, so sorry. We hold a lot of community events and activities. So one of our major events is our back to school healthcare community that we always have in August, which is exciting. Our kids come and their families come, so the way the community can come together and they can get supplies for school. Also other vendors are there and they're able to, assist with their programs or educate, the community on, their personal organization. So it's just a way for the whole entire community and other organizations to collab and, to do more for Charlotte and the other counties and other, cities around here. Our annual turkey drive is, we just had, and it was fun. Royals was there. Do you want to talk about our turkey drive, Roy?
Yeah, I can speak about the activities. Yes, the community activities, as you indicated, the back to school health fair is usually held in August. And we usually, give the kids the backpacks, the, physicals, and we have the hot meals, hot dogs. And the annual turkey drive is one of my pet peeves that I always do. We gave out over 150 turkeys and boxes along with the turkeys. And also the toy drive was a success where we give kids toys, 1 or 2 toys they can select from the tables. That's one of our great events that passion to me. And also we have quite a few other events that's in progress that we're looking forward to doing, and we have an upcoming gala that was going to be held coming in May the 2nd. So that's something. Usually, guys, we have the luncheon. Everybody familiar with the CW Williams luncheon that we put on, and actually our CEO Ms. Weeks and I actually started that about 8 years ago. So I'm on board with the gala, so you'll hear more about the gala that's coming up in the future. And continue to support our community activities, because I'm the guys who's been out there in the communities making sure that we reach the ones who really need our services. Thank you.
Thank you. And what's great about the toy drive, normally when you think about toy drive, you think about the little ones. We actually provide things for toddlers to actually our high school students. So we don't forget about our high school students. So that's something, because sometimes they come and they look and they see only things for the little ones, but no, we have things for the older kids too, and it's a joy to see them able to get something from our toy drive as well. And thank you, yes. So this year, yes, we're doing a gala this year, May 2nd, for the fundraising. Like Royal said, it's normally a luncheon, but because this is the 45th annual anniversary, we're doing it a little bit more special. So we decided on a gala. Accomplishments. So some of the accomplishments that CW Williams has had is Patient-Centered Medical Home, the PCMH. We were recognized by them. We are recognized in the community for providing exceptional medical and HIV care, providing affordable and comprehensive care, and using mobile units to provide care to those housed in residential facilities. So something about, like, for instance, Dove's Nest, that's one of the people we collaborate with. Our mobile units are able to go to these organizations and these housing facilities and able to provide care. Also, something that we do is, for instance, I want to say probably twice a year we have a breast cancer mobile unit that comes to our facilities. We let our patients know that it will be on site and women can get screenings. We also have a lung cancer screening unit that we collab with. It's not ours, but we do collab with so that our patients can go get screened. So we try to make sure that all different, I'm so sorry, I'm still a little nervous, believe it or not. So we try to collaborate with many organizations and many medical, sorry, the words are escaping me at the moment. What we try to do is make sure that our patients get what they need, even if we don't have it. There we go. So, so collaborating such as with the lung cancer mobile unit and the breast cancer screening unit, it helps because those are things that sometimes our patients, since it's not at their doctor's office, they won't take the extra step to go and get looked at. It becomes complicated for them for whatever reason. And as we know in our personal lives, when we're referred out, we're like, oh, where do we have to go? And oh, now I gotta go get a referral and I gotta wait. And it's just, so, we get discouraged to take care of ourselves, and it's kind of crazy. So, like we said, one of the ideas and dreams that Dr. Williams has was that we made sure that we cut out the difficult parts of access to care. So that's why we collab with so many different people and we do what we do. And we're done. So now we have a Q&A section. So thank you for hearing my presentation. I'm so sorry that
Thank you so much. So now we will have questions from our audience, and the first question will come from Mr. Ken Coons.
First of all, I've known C.W. Williams personally and have known the clinic ever since he started it, and have been a patient there for more than 30 years. So C.W. Williams is something very close and personal to me. And I've actually done quite a bit of things through C.W. Williams from a PR perspective and events perspective. So to start out with the questions, I've got a whole litany of stuff here, but I'll just stick to one of them. Let me pick one. What's a tukey?
Tukey?
Yeah. You answered the question when you said turkey. Turkey's in your.
Somebody like questions now?
Is that the question? Is that the question?
No. Do you have a podcast?
No, we do not. We do not have a podcast, but we have been asked to and interviewed on certain podcasts, but we do not have our own podcast, no. But that is an idea.
Yes, we do have, social media. We have, Facebook, to Twitter, and Instagram. So we have the basics. But that's something that can be considered now because everything is going podcasts. So that'd be great.
It's my time? Okay. My question is, how, I know you share with us some information, but can you share with us how many doctors you actually have staffed through both locations, and how many patients you all service on a monthly basis in all of the areas that you have? Do you have that information?
So, providers that we have right now, just gonna do a quick mental rundown, so sorry. We have 6 providers right now, between both locations. So right now, 5800 is our late night location. So what happens is our providers are divided between both buildings, but then once 3333 closes at 6, our late night providers head over to 5800 to assist for the late nights because, as you know, people work, so we have more volume during the night. As far as patients monthly that we see, I can get that information for you because I don't have that off the top of my head, sorry. Did that answer your question?
Oh, yes, yes. I just wanted to know about the numbers.
They're all listed right here. In the brochure, they list all the providers and all the different types.
Atrium and Novant are major healthcare providers in our community. How do you coordinate with them with what you do and what they're supposed to do also? I mean, it looks to me like you're standalone. I would assume and I would hope that you coordinate with those folks. And if so, how do you do that?
That is a very good question.
Well, there's, some partners in terms of what the other healthcare systems in the city that we do actually partner with. They have different programs, or we invite them to our, programs that we offer. So we do get involved with Atrium, Health and Novant. So there's no divided, we are partners in the community, so we always kind of exchange different ideas. In terms of outreach, general outreach.
No, I was just telling them I had a second question. I didn't want to ask 2 in 1. First question, I'm well aware of the efforts that you have reaching out to the community. I know, Julius, you and I established a rapport back when I was running the Black Chamber. Do you have relationships currently with schools, particularly ones that are within your community, where they have a host of students who are within families that are underserved, lack medical care, lack insurance, etc.? Do you have relationships within those schools in your communities?
Oh.
Go ahead.
And if so, what are some of the efforts you do?
Yes, we have, and also with the university, in terms of with outreach, when I was on the outreach program, and I'm gonna get to your point with the, CMS, but with colleges, we go out in terms of the HIV programs, because we go out and do testing at the universities, because we, as you know, sexually transmitted diseases are very high around the college areas. In terms of going into the public school system, that is something that we have reached out in the past. But sometimes we have, it's a breakdown of communication to get a respond back with CMS. So we're actually still trying to engage and to build that bridge, and that's something that we look forward to doing, continue to do to get out into, to some of the families with the school system. But it's a lot of red tape when you're trying to go into the school system. And I know the educator back there on the board, she can have to bounce off on that for me. We would like to get it more involved with the school system.
The easiest way is going directly to the school.
But we do have relationships with the school, we do, because our dental team goes out and does dental screenings for the students, especially in the elementary schools. So we do. We also have had schools reach out to us, especially for the football teams. As you know, one of the requirements is for the students, the boys, to get physicals. So they have reached out to us and asked us if we can set up something for their students and their parents to come one day and get those physicals done for them because they need it by, a certain date and so on and so on. So we do. As far as expanding, yes, of course, we want to expand more and do so more within the school communities. We do have relationships also with some of the universities also here.
Thank you, and thank you for all you guys do. You do a great job. My question basically was the same as Gary's, And I can tell you as of today, if I get your information, which I have yours, but we'll get the information, we will arrange a meeting with the individuals who work directly with the schools. Because what you're talking about, fees, food, transportation, clothing, translation are things that our families need. Those are basic things. So the question is, how do we make sure, Ken talked about podcasts, how do we make sure that the schools are aware that these services exist in 2 places? So I will make sure I get with you guys today so that we can at least start the process.
Thank you.
Thank you so much for that. Ken. It's Ken, Gary, Rick, and Jack.
Jackie.
Since he's already been, you can let him. Okay, I'm sorry. Go ahead, Ken.
Okay, your earlier question in regards to partners, I happen to know because, as I said, I've been a patient there for 30 years. But you do have connections with the other hospitals through those patient portals because my doctor has used them and I have given him access to those. So in that regard, you do have some reasonably good relationships with the others. My question is in regards to the actual contact services. You mentioned about 60,000, 30,000 people that you see. Are any of those duplicative numbers? In other words, if you see one person 5 times, or they counted 5 times in those 30,000, and the byproduct of that would be in terms of relationships that you have with those people. Because personally, I can tell you, your phone system really sucks. Really, really does. And the follow-up through that is horrific. So that is something that I've always complained about. But those patient portals are available, and to what extent do your doctors take advantage of those when they're dealing with people's care and how they're being treated when they're referred out?
Yes, we want to be transparent, and when we had a conversation earlier, when you mentioned about the phone calls and can't get through different problems, and I personally would share that along with Ms. Fuentes and with Mrs. Weeks, the CEO, because every organization have flaws, and we want to correct our flaws, and if there's something dealing with our calling system that you can't get through. I thank you for bringing that to our attention, because we definitely want to look into that.
I do want to say also, right now, we have added a call center, so that has helped with the call volume that our front desk personnel have been receiving, and when they're dealing with patients in front and multitasking. So the call centers, the calls will bounce from our main facilities to the call center. So that has alleviated. We still are currently like Royal said, be transparent. We do have, why are the words escaping me? We do have, we are training for our front desk personnel. We have monthly trainings basically on customer services, of how they should respond to certain situations, how to answer the phones, and be present even when people are in front of them, and so on. So we do understand that that is a concern that our patients have, and it's been brought to our attentions, and we are actively working on it. Even to the point as well as educating our front desk on some of the, with our providers, teaching them how to navigate where certain phone calls should go, and how to be responded to when they receive them.
Good morning. Good morning. You indicated that the dentistry was on Weber Street, is that the old Spurgeon Weber office?
Excuse me?
Our old,
It's Weber Avenue, Dr. Weber, like, I believe
it
it's
was
Weber.
Spurgeon Weber's office years ago. Is that,
Oh,
I'm
you,
not-
you talking about in terms of the demo?
Where it used to
Yes.
be. Yeah,
Okay.
I don't remember that name, I'm fairly new, but I knew, Weber Avenue, that's where we were.
It is.
It
It's
is.
Weber,
Okay.
it's Weber right there, yeah, I remember that. Right off of Petty Ford.
That's where it is,
Mm-hmm.
where we used to be,
Where it used to be, yeah.
yes. They were gracious to
Dr.
have.
Weber's office was there too.
Down the street from
So Dr. Weber's office is no longer there?
No, Dr. Weber's office is there. He was kind enough to allow us to
Work
be
out of
there,
it.
work
Yeah.
out of his
okay.
Yeah, we just passed the
facility.
service over.
But
That's
we
perfect.
we have our own dental at
Gotcha.
3333 Wilkinson. But that's where we were located before, and that's where our patients would go.
So as part of referrals, we refer that our patients out to Dr. Weber during the time.
Did I answer your question?
yes, I
We
got it.
did have our own dentist there as well, but there were certain things that she could not do. So we did refer some of our patients to Dr. Weber.
Thank you. The CEO letter in your packet says that one of the reasons that the center was created was to right the wrong of healthcare disparities that have shadowed our community for too long. Do you believe that the wrongs of healthcare disparity have been righted by what you're doing?
Go ahead. Personally, I think so when it comes to healthcare, there are certain treatments that happens in terms of getting treatments, in terms of, I don't like to just give out, the name of all the healthcare, facilities and say, but in terms of the African American community, we were lacking certain healthcare and patients getting the right service and the treatment. So this is something that we wanted to kind of, create into in our communities, that we can provide top service and medical care, that you wouldn't have to feel that you would be neglected from being treated for certain illness.
One thing that we tell our employees is we ask, where does the healthcare start? Like when the patient walks in, when does their treatment start? And a lot of them were saying, when they see the doctor, and we would tell them, no. And they're like, they would look at us like we're crazy. And we're like, think again. And they're like, well, when they see the doctor, they get a treatment plan, they tell them their issues, and then they need medication or they need to be seen by somebody else. We tell them it starts the moment they walk through the door. How many times have you gone to a doctor's office and you're just not in the best mood? You have 1,000 other things on your mind, and then someone says the wrong thing or in the wrong way, and it just ruins your experience. So I would like to say we are actively always trying to continue that, make sure that we get to a place and be an example, that can expand outside of C.W. Williams with the treatment of patient care. So that's something that we try to, things like that is why I appreciate C.W. Williams, those little things that we try to teach, our employees of how to carry themselves and be the kind of people they would like to interact with, on their personal level. Kindness goes a long way, and just to make somebody smile, it helps.
All right, we have Gary, then Ken.
I guess that was a great question that I can piggyback off of a little bit with mine. You alluded to a little earlier that you have a cohesive relationship with the other medical partners in the community, Atrium, Novant. Do you have a financial relationship with them? And if not, what would be the hindrance to establishing even a micro financing thing?
Honestly, I'm gonna be transparent, I can't answer that question, I don't know. Do you know what it is?
And I definitely don't think it's a financial, on that part, so.
Okay, I have a question, and then Ken. My question is, you talked about the clothing closet. Are you all partnering with anyone, and have you all started implementing that? And what is the process, and where will it be located, the clothing closet?
So the clothing, that's something we're working on right now. Right now, what has been happening is just our employees have been bringing in gently used clothes for some of our patients. We know, especially right now during the winter, during Christmas, some of our youths were in need, and a few of the moms came in, and so we're working on a program, an official program, because we do have an official food pantry program, which they work with other organizations. The names escape me, but I can get you that information. But what we're working on now is the clothing drive. Yeah.
The Friendship Missionary Baptist Church has had a clothing store for quite a while, and it's about to close down, or will be closing down. And I'd like to suggest that perhaps you may talk to them in regards to what their planning was beyond that. But my question to you is going to really get difficult now. With the new administration in Washington, there's plenty of concern about federal funding and support for a variety of things. And being that C.W. Williams is a federally qualified community health center, what is your organization's expectations or preparations for what changes are expected or could come from the new administration? Y'all don't know.
I was.
That's a question. Politically, it's too early to tell. So that's the answer to that one.
We do know the concerns as to what may be, and it's not just us. There was recently here in Charlotte, there was recently oh my God, the words are escaping me today. A lot of the FQHCs got together, and that was part of the discussion of how they can, I guess, troubleshoot of what may come or what's to come. So it hasn't escaped, the conversation or the concerns that is on board. But as for me personally to answer that, I can't say. But I am more than willing to get these questions and bring them to Ms. Weeks, and I'm sure she can get you their responses and send it to someone who can share it with you.
Again, I want to say thank you. Laura, you asked the question about the clothing closet. Y'all can come pick up stuff from my house today. I'd love for you. I think that is so needed, especially where you're located. The food, everything that we said earlier is so needed, and I want you guys to do it and be organized. But I'm concerned about the publicity and how you are marketing this and sending it out. Every booklet that is left today, I'd love to take with me, because I think, are you partnering with Crisis? Are you partnering with Second Harvest? Are you partnering with these individuals? And I know that they might not have the financial benefit of Atrium and Nova. You do have the respect. So there needs to be more collaboration where they can get some funding. But the problem is you have to go out and you have to seek it. And I don't want to, anyway, there's so many opportunities, and I want you guys to take advantage because his reputation precedes him.
Thank you.
Going back to the question that was asked by Mr. Kuntz about how are you going to respond to things that's coming with this forthcoming administration. You may not know how you're going to respond, but can you speak on some of the issues that you might be facing coming up with this new administration that you may not have had to deal with in the previous administration? So things that you might know that are on the horizon.
Well, Gary, we look at healthcare as overall, because it is something that for years in different administration, I don't think that it's going to affect us. In my opinion, being political, and been in at the White House. I'm a former Clinton advance person, And I just feel that when it's coming to healthcare, there's so many, opposition in the other parties. I think we won't see a major effect with, healthcare because it's a big issue. Now, I don't think, the administration is going to change that much. I'm going to be optimistic about it because I'm always say, there's a high power, and that high power is not going to let it affect us.
If no one is advocating for you.
Well, there are the organizations in Raleigh that we're affiliated with, so they collaborate a lot in terms of government relations, and we do have that in place. So Ms. Weeks is the key person, our CEO, that actually engaged with, I can't think of the name of the organization, but I know that they're based out of Raleigh.
Yeah, that's what lobbyists.
That's
what lobbyists.
Right, got it.
I got a question. So I know a lot of HCs are operate on a sliding scale. If I want to say, is it patients? What's the correct terminology now? What do you use?
Patients.
Okay, all right. If patients are not able to meet those financial obligations, will their credit be impacted?
So, I'll be honest, I don't know that answer, and I don't want to give you the wrong answer. All I do know is that they do work with payment plans, and they try their best to assist with every individual's circumstances. So it's not like they're left hanging and dry. We always do everything to assist them and find ways that we can help them in whatever circumstance they find themselves in. But like I said, if all these questions that I have not been able to, properly answer, I ask that you please meet with me after so I can write them down and get you the exact answer,
And kind of a follow-up, since we don't have any more questions. What is the intake process for those specialized services? So you had acupuncture, or is it a difference? What is the intake process to get to some of those specialized areas of medicine?
Well, you can, if you're looking for acupuncture, you can just call and make an appointment and become a patient. That's pretty much it. Like I said, we take insured patients, underinsured, and uninsured. So you can just call our facility and they'll make an appointment for you.
Is that market rate service like for acupuncture? What are you comparing the cost to?
You are asking me.
Okay, all right. But if someone expressed interest in engaging the service, the myriad of services offered by C.W. Williams, what does that process look like? Are they able to just book an appointment online, or
So there's multiple ways to do this. You can walk in, make an appointment. If you have especially like a very serious situation that you're walking in for, we will squeeze you in between patients. We'll make sure you're seen. On our website, you can book an appointment there. You can call. Also on our social medias, messages are sent, and then those people will request for appointments, and they are given to us daily, and we call them back within 24 to 48 hours and make the appointments for them. And it's all different types. I'll have people send messages saying, hey, I need a dental appointment, and then I'll troubleshoot it to my dental team. They'll call them to make the appointment. Some are asking for physicals or cost of like certain things, and we'll send it to our medical team, front desk, and they will reach out to the patients.
Thank you. Thank you. We got Ms. Jackie for a final question.
Oh, mine is more than an announcement.
Oh, it is now. Well,
I have a question. I just want to ask you, how many pharmacists do you all have at the 2 locations?
So we have a total of 4. A total of 4 pharmacists, yes.
Again, they're all listed right here.
Thank you.
Some of our newer pharmacists aren't there, we're working on
We have
updating.
4 here.
Oh, we still have 4 there? Oh, okay. Oh, it is. Oh, thank you. It did update
See,
it.
they got the
Yes.
names of everybody.
Oh, yes. Because I was gonna say, I don't think Jasmine Butler, Kevin Barnes, Dr. Butler, Dr. Barnes are there. Yes. So yes, we have a total of 4. And now we just recently started so technically 5, because we just started a part-time one. So yeah, so 5, technically.
Well, Ms. Fuentes, we definitely appreciate you for your presentation.
Thank you for your
Telling us all
patience and grace.
the amazing things about the C.W. Williams Community Health Center. Please, if you have any closing remarks before we go into announcements.
The only thing I can say is take care of yourselves, honestly, first and foremost. If something's bothering you, don't wait till the last minute to get it checked out. Seriously, don't. You have your own individual communities and families. Waiting is not the best policy, even if you're trying to not face the music. If you want to come to C.W. Williams, we have a support system there. We'll be there if you need someone to sit with you through the appointment. We got you. And just spread the word about us. We're trying to, continue our story and do right by the community. And we just thank you guys for having us here today. And I pray I did justice by us because this is my first forum. Very nervous, but like I said, any questions that you have that I could not answer, please come see me. I would really want to get that information to you, okay? And once again, Ms. Weeks apologized for not being here. She was ill today, and that's the only reason I had to step in. So sorry.
No, thank you. It's very informative. Thank you, Ms. Fuentes. You heard it. Take care of yourself so you won't have to go bother the people at C.W. Williams. Put it on you. We will go to announcements from the audience. We have one from Ms. Jackie Edwards-Walton.
Yes, I think there is some legislation or something coming down from Raleigh regarding medical debt
Today.
and its effect on our credit report. So I wanted to kind of put that out there. And the other thing is, on the second, Winston, correct me, on the second Tuesday in February, we will have some folk coming regarding, I call it the Old Black Professional Building, that was on, it used to be on Independence, it's no longer there. But anyway, I think that C.W. Williams, they were part of that group also.
Had an office that practiced out of the.
Well, I know sickle cell was in there and some other medical professionals. were
Well, the
in
black
that
building, six, it was all through the place.
Absolutely. Thank you.
Yes, and again, thank you for that lob to announce that our annual Black History Month programming will be spectacular, beginning February 4th. Well, I won't even drop it. We got to save it because I got to get some more confirmations. But the entire month of February, we will highlight the important and significant history of Black Charlotteans and the strides made to make this city as great as it is today. All right, Ms. Carlini.
Thank you again. January the 18th is the Growing the Dream. So if you haven't signed up, you need to get in touch with, send me an email, like today. And also, you guys announced May 2nd, and we talk about funding. That is one of their major fundraisers. So you need to get flyers to us and to Steve, because that is a major fundraiser where you raise funds to help these families. So make sure you get those flyers to us as soon as possible.
We do have save the date, so I will make sure you get some of those.
All right, we got Ms. Tanya Ravens, we have Shane, and we have Ken.
I was just going to follow up on what Jackie said. It's actually national, and all the media outlets are reporting it. I'm with Radio 1 Charlotte that the Consumer Financial Protection Bureau already announced they're removing all medical debt from credit reports. So that's good news for a lot of people. I just wanted to announce that The town of Cornelius, for the first time ever, is hosting a Martin Luther King Jr. celebration through my nonprofit, along with one of the AME Zion churches, Torrance Chapel. So not only Cornelius, but Huntersville as well. So we're making a lot of progress. So from Davison at 10, Cornelius at 12, and then Huntersville at 3 p.m. We get to celebrate all day. So we're excited about that.
And that is one of the members of a legacy family of long time North Mecklenburg black folk. Nice. All right, we have Shay, Ken, and Dr. Thomas.
Thank you. I just wanted to make a quick announcement to, number one, thank Mr. Ken Coates for coming out and supporting. We had a great National Reads Across America Day at Cedar Grove Cemetery. If you guys haven't heard of that or about it, Ken put together this awesome memorial book that's available to anyone who's interested in learning more about that project and seeing some of Ken's really dynamic work. And you can own it. Thank you.
All right, Dr. Thomas.
Several years ago, President Carter came here to Charlotte to open up, it was a Habitat fundraiser. And he came right over to the piano where I was playing and thanked me for playing. But what they told me that this man constantly looked around for people who were providing services for whatever agency he was involved with, but pay attention to whatever is going on in his honor this week. Thursday is when I think they're having his service, the national service is coming Thursday.
That's correct.
But I thank God for Jimmy Carter, President Jimmy Carter.
Rest well, President Carter. If I'm not mistaken, he came literally right here to Optimus Park to build Habitat Home. So he was, right around here, right around in this neighborhood, Optimus Park. Mr. Coons.
I had the distinct honor of having covered Jimmy Carter when he came to Charlotte on a campaign trip, and it was at the square. I think the Radisson was under construction at the time. Also, I had the pleasure of going to Brazil and a Carter-initiated initiative called Friendship Force in 1980. That was 44 years ago. But finally, I want to acknowledge Shay. And this is not a shake hand, kumbaya society. But this brother volunteers teaching or reading to students at University Park Elementary. And a little over 2 years ago, coming out of that, he looked across the street at this cemetery, which has been adjacent to University Park since the 1880s, and not adjacent to University, it wasn't there, but it's been there since the 1880s. And the last burial was in 1992, and that was probably the last time anybody thought about cutting grass or clearing a grave. But Shay saw a guy doing an interview in that overgrown land, and his curiosity took him there to find out what was going on. And this group was he was doing an interview, the guy was, with WFAE about his project in a master's program at UNCC to clear that property, the Cedar Grove Cemetery. 2 years later, Shay, who stayed the course for 2 years, helping to make that clearing happen. And they held that Reads Across America, which was in 4,600 locations across the country, only 2 in Charlotte, Forest Lawn and Cedar Grove, which would likely not have been had it not been for the group that Shay joined to clear that cemetery. So I wrote an article about it. It's in the Charlotte Post, it's in the County News and Q City Metro. So if you want to go online and see it and read it. But thanks to Shay, who is probably one of our best kept secrets in terms of his devotion and dedication to doing things in Charlotte Mecklenburg.
Indeed. Shout out to Shay. Shout out to Shay and the Cedar Grove Project. Persistence. If anyone has any other announcements, please send them to steve@sjoston@tuesdayforumcharlotte.org. And with that said, we will see you next week where we have another spectacular guest. All right. Happy belated White Juneteenth. It was January 6th was yesterday. All right, we'll see you next week. We'll see you next week.
Thank you so much. Appreciate you.
I